The warehouse has an oxygen plant that can produce 100 cylinders per day, a central vaccine workshop, cold rooms, among other facilities. Museveni says Uganda's main focus should be on the local manufacture of medicines and vaccines and focusing on public health and stopping preventable diseases.
And health would include preventing sicknesses and treating the few that are not preventable. That's what the education should be about. But not specialize in allowing people to be sick and encouraging them to be sick, and then you wait for them in the hospital. This is not. This one it takes a lot of resources unnecessarily.
He asked the managers of national medical stores to fight drug theft because it's one of the causes of poor health service delivery in Uganda.
When you go to Congo, just over the border, you will find these drugs there. And you will find them in South Sudan. So that's where all of you, partners and friends, need to work together to solve the other issue of the last mile of the drug.
US Ambassador to Uganda Natalie Brown asked Ugandans to get vaccinated for COVID-19 to prevent vaccines that were shipped into the country from getting wasted.
It remains a concern, especially for vulnerable individuals, and vaccines for initial shots and boosters are available and need to be administered appropriately before they expire. As we work together to contain and prevent the spread of the Ebola virus, we cannot ignore the other public health threats.
Moses Kamabare, the general manager of National Medical Stores, says the new facility will improve the availability of quality essential medicine and supplies.
Our current NMS location will remain as a branch that will be dedicated to the surge and emergency operations, especially warehousing supplies for academics and the other non-routine supplies that we handle.
$1 million financing contributed by Gavi, the facility alone will house 7 state-of-the-art cold rooms and 2 freezer rooms. In addition, there will be freezers for ultra-cold chain for vaccines that require that. This will enable the NMS warehouse to offer a 5-fold increase over the storage capacity of the previous NMS warehouse in Entebbe.
Health Minister Dr. Jane Ruth Acheng says there should be no failure in the timely delivery of essential medicines and health supplies to health centers.
To have, in a timely manner, operational funds that are needed for distribution of essential medicines and health supplies to health facilities. This challenge is caused by the inability of national medical stores to timely access operational funds through the integrated financial management information system.
National Medical Stores warehouse is valued at shillings 27 billion. The file was compiled by Shamim Natebwa for CTV, PM Edition.